Sadly, patient number 4 died because of Legionella outbreak, which is happening in Manhattan, Upper East Side. I know that all the news is scaring you, but here I'm coming to reassure you with medicine. I want to tell you what is the symptoms you look for. I want to tell you why you should be reassured, because there is very good news I want to share with you. So why you be reassured? First, that Legionella bacteria never been transmitted from person to person. So it's never going to be pandemic. It's going to be in this local area. Number two, that the cause or the source is detected. The city went and took samples from the cooling tower. They found the bacteria and they cleaned this cooling tower, and now it's negative and there is no more bacteria there. The third good news that the numbers is declining. You're gonna tell me how numbers declining, and you just told me that the death is rising. There is 4 cases. No. In any outbreak or pandemic, when we look at it, it starts with cases. Then those cases go to the hospital, and then those cases in the hospital, some of them will be sent home and some of them will die, because this is a very strong infection causing very bad pneumonia. But what we look actually for, we're looking for the new cases. This is the source. This is the start, will accumulate after. So when a patient exposed to this bacteria, take 2 days to 2 weeks incubation period for him to develop these symptoms. But why I'm telling you that it slowed down? Because July 2nd, the first 2 cases reported, then July 12th was jumped to 59. Look at sharply increased in this 10 days. Then by July 15, 64, still we increasing and accumulating. By July 19, start to slow down, 74, and we can say it's the same curve going. But look at the last 2 days, which is July 20 and July 21, only 2 cases reported, so 76. So there is a slowdown, because if not slowing down, you're going to see the numbers like 10 today, 20 tomorrow, 32 after, and then this is the outbreaks is building up and accumulating. No, this is not the case here. Numbers are declining. And as I explained, even if you see and you hear in the news tomorrow that patient number 5 or number 6 died, do not be scared. The question now you should ask yourself, what is the symptoms those people who are living in this area, or if anyone was doing something in this area, develop, must go to the hospital right away. Like if you have fever, and it's gonna be high fever, if you have cough, bad cough, and tightness and shortness of breath, very bad headache, muscle ache. If you have these symptoms, you go to the hospital, they check you, go early, don't wait. They give you test, and if the test is positive, they give you the antibiotics early. To share it, repost it for everyone. And this video is just educational, not a medical advice.